day in the life of the radiologist is mostly interpreting imaging, so patients having x-rays, CTs, MRIs, ultrasounds, and we're looking at those images and coming to a diagnosis and writing a report to help doctors on the wards and GPs and things to decide what to do with their patients. We also do a lot of interventional, so procedure stuff. So injecting a lot of, injecting joints or putting lines into people's arteries and veins, or putting big needles into abscesses and things. There are a lot of things that really stick out in my mind thinking back to uni. Probably our whole first year was before they'd finished building the School of Medicine building at Campbelltown. There was about 90 or 100 of us, and it was great just in terms of making friends, and it meant that you had sort of 90 to 100 people that you actually knew really well by the end of first year, and that carried on quite a lot for the next 4 years, which was a lot of fun. I was surprised how smoothly everything went, because I was in the first year of the course, and I think everyone on the administrative and the teaching side was so keen for it to go well that they just made it really positive and were very enthusiastic about teaching us. It definitely helped having really friendly and approachable lecturers and mentors, and it helped a lot just starting those later hospital rotations and having friendly faces, people that you knew from the earlier years. And I guess on a personal level as well, it made you feel comfortable that there's people aren't so scary, there's other people in senior positions. So I think some of the experiences that shaped how I am as a doctor now, a lot came from doing the more community type rotations, which we did a bit in third year and fifth year, where I guess I was exposed to a lot of situations that I never would have come across otherwise, like spending days at the methadone clinic at Campbelltown Hospital, or like the Aboriginal Health Service in Ayres. I think that is maybe a less judgmental doctor. I think Western Sydney graduates, we've got a pretty good reputation from my experience when we were interns and residents. We're always very friendly amongst ourselves. I think that's definitely a discriminator, that we actually knew everyone from our own university, unlike a lot of people from other unis. For students starting out in medicine, my main piece of advice would be to try and be supportive of everyone you're going through med school with. It can be very easy to become very competitive, but you're better off forming a good group of friends and helping each other through all the challenges that you'll encounter. And I would also say that you need to have a work-life balance, and you can't just put all of your life on hold to get through 5 years of medical school. You need to have some fun along the way, and you need to combine those things in the right quantities to make the most of it.